our history of the fever up to 39.5 degrees Celsius. Now see the emergency room. If the somebody is coming in the emergency room, the first thing you have to see, you have to stabilize the airway of the patient, because you have to follow the criteria, that is the A, B, C. What is that? A, then B, and then C. What is that? A for we have to airways you have to maintain. The child's look alert, anxious, and has a mild inspiratory stridor. So the inspiratory stridor means there's some respiratory tract involvement would be there. The first things in the emergency patient, the you should immediately do what? Prepare the establish an airways. The airway management is the first priority in all these emergency cases. Then question number 50, a 7-day-old boy is admitted to the hospital for evaluation of the vomiting and there is a dehydration. Physical examination otherwise normal except for the minimal hyperpigmentation of the nipples. देखो, there is a minimal what? Hyperpigmentation of the nipples. Serum sodium and potassium concentration are 120 milliequivalent per liter and 9 milliequivalent per liter respectively. The most likely diagnosis is what? That is what? Congenital adrenal hyperplasia. Because see, there is what is the normal level of the sodium? What is the normal level of sodium? The normal level of sodium is 135 to 145 milli equivalent per liter. What is the normal level of the potassium is what? That is the 3.3 to 5.5 milli equivalent per liter. In this question, what we are going to see, or I'm writing it here, see that here we would be having the sodium, and this sodium, it is what? It is in the lower side, and potassium is what that we are going to see, that will be on the higher side. Sodium on the lower side and potassium where on the higher side would be there. So both things you can, what you can imagine here, the sodium and the potassium. See, the sodium and the potassium, there is a one hormone in our body that is responsible for sodium in and potassium out. Which hormone is that? कौन सा hormone है वो? Aldosterone, what they do, it welcomes the sodium and bye bye potassium. It aldosterone, what they do, it will welcome sodium and bye bye potassium. Bye bye potassium means the sodium will be increased in our body, aldosterone will be increased, and the potassium will be decreased. The opposite will be there, like if you would be having the decrease of what aldosterone level, so sodium level would be decreased. So and potassium level would be decreased. So it will happen in the case of, because this is a 7-day-old boy. So this is a case that we'll see in the congenital adrenal hyperplasia. Okay. So let's discuss today एक अच्छी चीज पढ़ते हैं, that is about the endocrine. ठीक है, about little bit about the endocrine, and in which we will discuss all the endocrine systems, like all the endocrine glands and the hormones. ठीक है. So this is your separate topics, and you will be able to understand the whole endocrinology, the endocrine glands and hormones. Okay, firstly let's see the image. These are your major endocrine glands that we are going to discuss. Let's first discuss about the hypothalamus. What is the hypothalamus? The hypothalamus, see, if in our school, what we would be having, we have the principal and we have one headmasters, or in the, you can see in the hospital, we would be having one HOD, head of the department would be there, and there would be the one other superior to that, that is what? Administrator of the that hospital, who is running that hospital. So hypothalamus is what? That is the administrator of that hospital. Because the hypothalamus, it is the topmost thing that will be having. If the hypothalamus will not be there, there will be the no pituitary function will be take place. So this is what? This is the super master gland. This is the super master gland. What they will do? They produce two kind of the hormones. They will produce the two kinds of the hormone. Just a second. So we would be having the hypothalamus, and hypothalamus is what? That is the super master gland. Where it is located? It's located at the base of the brain. It is located at the base of the brain, just above the pituitary gland. Just above the pituitary gland. Hypothalamus is what? It is the endocrine gland. It also what? It is the part of the diencephalon, the thalamus and the hypothalamus. Diencephalon, we have the two parts. We have the thalamus and the hypothalamus. So basically we can say that this is the part of the nervous system also. So that's what it do. It connect the nervous system to the endocrine system and control the many bodily functions by releasing the hormones. What kind of the hormones they will release? It releases the two kinds of the hormone. The one we would be having, that is the releasing hormone. That is the releasing hormone. And another one we would be having, that is the inhibiting hormone. That is the inhibiting hormone. What are these releasing hormones? The releasing hormone here we would be having, that is the thyrotropin releasing hormone. What is that? Thyrotropin releasing hormone. That is the thyrotropin releasing hormone. What it will do? It will stimulate what? It stimulates the thyroid stimulating hormone. They will discuss the TCH, and that is secreted from the anterior pituitary gland. Then we would be having the another one, that is the corticotropin releasing hormone. The corticotropin releasing hormone, what they will stimulate? They stimulate the release of ACTH, adrenocorticotropic hormone. That is also secreted by the anterior pituitary. Then we would be having the gonadotropin releasing hormone. The gonadotropin releasing hormone basically what? That is the again by the hypothalamus. What the gonadotropin releasing hormone? They stimulate the release of LH and which one? FSH. Then another one we would be having the gonadotropin releasing hormone. Then we would be having some inhibiting hormone, like we having the somatostatin. We have the somatostatin. The somatostatin, what they will do? Inhibit what? Which hormone? That is the growth hormone. It inhibits what? Inhibits the growth hormone. And the second one is what? That is the dopamine. That is the dopamine. Can you tell me which hormone is inhibited by the dopamine? That is prolactin, the milk hormone. Prolactin. So prolactin will be inhibit the, you can write it like the inhibit the prolactin. Dopamine will inhibit what? Prolactin release. So these are the some kind of the hormone that we will be having from the hypothalamus. Now see, there is the three nuclei would be there. Okay, basically the nuclei you already have discussed in pro one time. So there is a supraoptic nuclei, ventral nuclei, and the lateral nuclei. We are not going to discuss that now. Okay. So we would be having what I was discussing. So we would be having, we have the GnRH, so that is, and the CRH, and we have the TRH. So they are the some releasing hormone, and one we would be having some inhibiting hormone would be there. After that we would be having the pituitary gland. After that we would be having the second gland, that is known, that is our, the second gland, that is our okay, that is our pituitary gland. So if you talk about the pituitary gland, remember the pituitary gland have the two parts. We have the anterior part and we would be having the posterior part. So we have the anterior pituitary gland, we have the anterior pituitary gland, and we would be having the posterior pituitary gland. We have the posterior pituitary gland. And I will ask you a very simple question. Where the pituitary gland is located? Which structure? Which structure the pituitary gland will be located? Trasica.
Trasica.
Yeah, sala trasica. So it is what? What is this sala trasica? It is the cavity in where? It is the cavity in which bone? In sphenoid bone. So it is the cavity that will present in the sphenoid bone. So it is just below the hypothalamus, in which what you are going to see, we will see the it is present in the sala trasica, that is cavity that is present where in the sphenoid bone. And remember that the pituitary gland, it is the master gland. The pituitary gland, we have seen the hypothalamus as the supermaster. So who is the master? Master is what? That is the pituitary gland. Why that is the master? Because it controls many bodily function and other endocrine gland we will see. So that's why we have seen that there is a divided into the two lobes, the anterior lobes and the posterior pituitary lobes. That the two lobes would be there. Then remember all the hormones of what? Anterior pituitary glands. Remember the hormones of anterior pituitary gland. See, in anterior pituitary gland or anterior pituitary lobe, we would be having around 7 hormones. What are these hormones? The first one, they will produce the growth hormone. That is the growth hormone. Okay, what is the growth hormone will do? Can anyone tell what is the growth hormone will do? Bolo.
It is responsible for the growth and development of bones and organs in the body.
Okay, so basically I wanted to hear about that. The growth hormone in the children, it will help into increasing the growth of the bone. But instead we'll talk about the in adults. So in the adults, the growth hormone will also work, but there will be the some cartilage growth would be there. There no growth of the bones would be there in the adults. Okay, that's why you have to understand that the growth hormone, it is functional in both, but function is different on the in the children and different. See in the patient with the, like in the children, so there will be the gigantism would be there. The gigantism. The gigantism you will see in the children. See where acromegaly, remember this is the common in the adults people, and the gigantism, remember this is the common in the children. The same thing, it is occurred due to increase of the growth hormone. Here you will see the more increase what? Bone growth. The increase of what? Bone growth. Okay, in children we call this condition as the gigantism. Okay, other thing, the other hormone we would be having in the pituitary gland, that is what? Thyroid stimulating hormone. That is what? Thyroid stimulating hormone. So thyroid stimulating hormone is what? What they will stimulate? Thyroid stimulating hormone. What they will stimulate, as the name is, see, there will be the thyrotropin releasing hormone that will stimulate the thyroid stimulating hormone, and the thyroid stimulating hormone is the hormone of the anterior pituitary that will stimulate what? Thyroid gland. That will stimulate the thyroid gland, and thyroid gland in the turns will produce the T3 and the T4 hormone. That stimulate what? thyroid gland, and that will release what T3 and the T4 hormones. Okay. The next one is what they have the adrenocorticotropic hormone. The next one is what adrenocorticotropic hormone. Adrenocorticotropic hormone. ACTH. How do you call this as the ACTH? Adrenocorticotropic hormone. What they will stimulate? They stimulate what? Adrenal cortex. This stimulates what? Adrenal cortex. What the adrenal cortex will do? If they will stimulated by the ACTH, they will release what? Cortisol. They will release what? Cortisol hormones. We will discuss about everything about the adrenal cortex. Then we would be having some gonadotropic hormones. Gonadotropic hormones. Gonadotropic hormone. What are these gonadotropic hormones? These are the stimulated by the GnRH that is produced by the hypothalamus. What are these? They are the two hormones. We have the LH and we would be having the FSH. Where we have discussed about the menstrual cycle. Okay, this is the previous group. So the luteinizing hormone, remember, they in females it help in the ovulation. It help in the ovulation. See, when we say na, there will be the LH surge would be there. If you have heard about the menstrual cycle, so during the menstrual cycle, we have one period in between. Like for if the 28-day cycle would be there, so at the 14th day, there will be the LH would be very at high peak. We call that is the LH surge. The LH hormone will be every at its high peak would be there. So that is known as the LH surge. And on that day, you will see there will be the ovulation will be there. So that's why the LH would be there. That will help in what? Ovulation in females. Along with that, if you talk about the males, they will help in the sperm. They will help in what? Sperm formation. They will help in the sperm formation. No, sorry. They will help in the testosterone production. They will help in the testosterone production. They will help in testosterone production. Then we would be having the FSH. What is the FSH? What is the LH? Luteinizing hormone. That is the luteinizing hormone. What is the FSH? FSH is the follicle stimulating hormone. Follicle stimulating hormone. As the name is saying, follicle. What are we have the follicles? We have the primary follicles, then secondary follicles, then tertiary follicles. Where in the menstrual cycle? When we discussed about the menstrual cycle, the 0 to 14th phase is what we would be having the follicular phase. After that, we would be have the luteal phase would be there. So during this follicular phase, we would be having the primary follicle, the secondary follicle, the tertiary follicle. So which hormone will involve in that? That is the FSH would be involved. So that's why the FSH, remember, stimulate the growth of follicles. They stimulate the growth of follicles. In which growth of follicles? That is in females. In females. Okay. And in males, what they will do? They will help in the formation of the sperm. So that is the sperm. That is known as a spermatogenesis in male. Spermatogenesis in males. Okay. Is it clear till now? Okay. After that, we would be having the, how many we have discussed? We have discussed the TSS, adrenocorticotropic. Then we would be having the next one that is known as the, which one? Prolactin. Which one is that? Prolactin would be there. Prolactin. What this prolactin will do? That is also known as prolactin. Basically, what is that will do? It will stimulate what? It will stimulate the milk production. It will stimulate the milk production. Dekho, there will be the two things would be there. We will discuss one other hormone that is known as the oxytocin. So there are the two things. The one is ejection of the milk and one there is a stimulation of the milk. Write it here also and write it there also. We will discuss about the oxytocin, write it there also. So remember the prolactin, that is the PRL, प्यारे लाल. So प्यारे लाल क्या करेगा? प्यारे लाल stimulate करेगा milk production को. It will stimulate what? Milk production. Stimulate the milk production. Stimulate the milk production. And oxytocin is another hormone that will what they will do, that is the mother hormones, love hormone basically. What they will do, they stimulate what, they stimulate the uterine contraction, they stimulate the muscle contraction. The breast muscles contraction will be done by the oxytocin. So that will help in the ejection of the milk. That will help in the ejection of milk. Okay? So like basically if we have the breast, so if the ejection would be there, that is done by the oxytocin. But if there is some lobules, lobules would be there. From the lobules, we will have the milk secretion would be there. So that is done by the PRNR. That is the PRN. So stimulate the milk production. Okay, is that clear? Then remember that the second one we would be having the pituitary, which lobe? Posterior pituitary lobe. Posterior pituitary lobe. Okay, from your knowledge, tell me how many hormones will be produced by the pituitary lobe, posterior pituitary. How many hormones will be formed by the posterior pituitary?
Two.
Depender how? Depender he left. When he left. So posterior pituitary lobe will produce how many hormones? 2 hormones. So your answer is what? Your answer is wrong. What if I say that they produce no hormones? They produce what? 0 hormones. Okay. So posterior pituitary lobe or the posterior pituitary gland.
Neuro hormones, like neuro.
What?
They produce neuro hormones.
We do write it in the capital form that posterior pituitary lobe that doesn't produce or secrete any hormones. So what the posterior pituitary will do? They will store and release the hormones. Stored and release the hormones secreted by hypothalamus. I was telling the nuclei. So the one nuclei is there that will produce I think ventral nuclei is there that will produce the ADH. And that ventral nuclei will be coming, ADH will be coming into the posterior pituitary. The posterior pituitary gland will store these hormones and they will release the hormones whenever required. Okay, so write it in the capital form that posterior pituitary gland, if somebody will ask you from today that posterior pituitary gland produce which hormones, so tell them the posterior pituitary gland doesn't produce any hormones. They just what? They will store the hormones and they will release the hormones. क्या दिक्कत आ रही है इसको? They will store and release the hormones. ठीक है? They will store and release the hormone. So okay, basically you have to remember that does not. Okay, they don't produce. So what? And they will stored in which bodies? Remember, they stored in the herring bodies. You can also remember this name. Herring bodies. That is within the posterior pituitary gland. Within the posterior pituitary gland. Okay. And what are these hormones? The stored and released hormones. These hormones, for example of these hormones are the ADH, antidiuretic hormone, that is also known as the vasopressin, and we would be having another hormone that is known as the oxytocin. The main question that will be asked from here, that which hormone is produced by the posterior pituitary gland. So say them that doesn't synthesize any hormone. Okay? They synthesize in the hypothalamus by the supraoptic and the paraventricular nuclei. By supraoptic and paraventricular nuclei. Supraoptic and paraventricular nuclei. So they are the two nuclei that will secrete what? ADH and the vasopressin. The ADH and the oxytocin. ठीक है. What is the function of the ADH will do? What the ADH will do? ADH क्या करेगा ADH? बोलो, बोलते क्यों नहीं तुम? बोलो. हम्म. भाई ADH what it will do? It will absorb the water. It will absorb the water. But I told you the water, the sodium is the girlfriend of the water. है ना? So if the sodium, if the water will come, then sodium will also come. But here is the again we have the some trick. Whenever you will see that the patient with the ADH, it will what? It will increase the reabsorption of what? Free water. They will increase the reabsorption of the free water. Where they will ADH? The ADH have the some vasopressin receptors. So we call this as the vasopressin receptors V1, V2, and they are present in the basically in the collecting duct. So where they will function? From collecting duct. Collecting duct is the part of the nephron. Nephron का कौन कौन से part होते हैं? Which part of the nephron? PCT, DCT, loop of Henle, PCT, loop of Henle, DCT, and the collecting duct. So these are the part of the nephron. And from the collecting duct, we would be having the reabsorption of the free water would be there. Okay, so that's why it will regulate what? It will regulate what? Vasopressin receptor, basically V2, present at collecting duct, CD. Present at the collecting duct. So it will regulate the water balance. Then oxytocin, what they will do? Oxytocin is very pyara hormone. That is the love hormone. Right? That oxytocin is what? That is love. So the love hormone, love between girlfriend, boyfriend, love between husband, wife. No, this is love between mother and child. Between the mother and child. Because whenever there will be during the pregnancy, which hormone will help in the uterine contraction during the childbirth? Oxytocin. The oxytocin, it will help in the help in uterine contraction. So which hormone will help in the uterine contraction? That will be the oxytocin during childbirth. So more connection between the mother and the baby, more contraction would be there because there will be the more oxytocin production. And if more oxytocin production, more milk ejection will be there. So it will also help in the milk ejection. It helps in milk ejection during breastfeeding. Is it okay? Is that clear? So remember that ejections, not secretion. The secretion is by the prolactin. Okay? Then the next hormone we have, that is our biological clock, जो हमारी सब की बिगड़ी होती है. What is that? Pineal gland. That is the biologically clock. Where it is present? It is present in the center of the brain. It is present in the basically in the center of brain. What they will do? They will regulate what? Sleep-wake cycle. They will regulate the sleep-wake cycle. So they can regulate each and every person except one category persons. Which category is that? पूरी दुनिया जहान को ये रेगुलेट कर सकते हैं, but they can not regulate one person. Which category person is that? That is the medical student. ठीक है, so because they have the disbalance of what sleep wake cycle, so that's why they can't regulate the sleep wake cycle of the medical student. Okay, so that's why we would be don't have the pineal gland. We sleep in the morning, wake up at night. ऐसे ही होता है ना? It happens like, yes. Then which hormone will be produced by the pineal gland? The hormone that is produced by the pineal gland is what? That is the melatonin. The melatonin, what they will do? They regulate the circadian rhythm. They regulate the circadian rhythm, and it helps with the sleep. So that's why it will help to maintain the sleep wake cycle. So remember, this is the mela. So pineal gland is what? That is the mela. The one thing we forgot here, I told you the seven hormones. So we have just told the sixth one, and then we so seventh hormone is what? That is the melanin. That is the melanin. The melanin basically, they in the initial time we would divide the pituitary gland into the three parts: the anterior part, posterior part, and the intermediate part. So the intermediate pituitary gland will produce the melanin. The intermediate pituitary gland. The intermediate pituitary gland produce the melanin. And all you know that is this melanin is responsible for, it is responsible for which thing? For what? For pigmentation. More melanin, it will be the more darker side. Okay, less melanin, there will be the skin will be more fair. So this which hormone help in the pigmentation? That is the melanin. Then after that, the pineal gland, we would be having the next one that is known as the which one? Thyroid. That is the thyroid gland. In Ukraine, we got the winters. In India, we got the winters. In other countries, we got the summer. In some countries, we got the winter. How we are maintaining our thing? Who is maintaining us? Who is maintaining us? Is that thyroid gland? Yes. So it helps in the regulation of our basal metabolic rate, BMR. Whenever we are going to any cold country, okay, any cold country, frozen country, so which hormone will help in the regulation? That will be our thyroid gland. So which hormone will come first, or which gland will come develop first? That is the thyroid gland will develop, and thyroid gland will update. That is firstly to maintain our BMR, to maintain our basal metabolic rate, to maintain our metabolic activity of our body. What is the metabolic activity? The reaction that is continuously going in our body, that will be regulated by our thyroid gland. So where it is located? It is located in the neck region. It is located into the neck region, where below the Adam's apple. Below Adam's apple. Okay, everyone knows this. So what is the function? They control what? Metabolism. BMR, basal metabolic rate. You can write the full form, BMR, basal metabolic rate. They also help in the energy production. They also help in the energy production. If you have studied about the biochemistry, in the biochemistry we discussed about the electron transport chain. We discussed, right? We discussed about the electron transport chain. In the electron transport chain, we discussed about the uncouplers, and the thyroid hormone is one of the physiological uncoupler. Okay, that will, what they will do? They will uncouple the oxidation phosphorylation. That's why they will uncouple the ATP production. So there will no ATP production would be there sometime. And the growth, they also help in the growth of, because they help in the metabolic rate. That's why they will also help in the growth. So what are the hormones that will be produced by the thyroid gland? They are the thyrotoxin. Sorry, thyrotoxin. क्या बोला मैंने? Thyrotoxin. What is that? Thyrotoxin. What is that? Thyrotoxin. ठीक है, इसको याद रखो, कुछ होता है ये. हाँ, thyrotoxin is produced, I think, by the thymus. ठीक है. So thyroid, we have the thyroxine. We would be having the thyroxine, and we would be having the triiodothyronine. Triiodothyronine. Or we can say tetraiodothyronine. Tetraiodothyronine. Okay, tetra basically we have the T4, and the trio means basically we have the T3. Again, the function you already know, that will help in the energy production, the BMR. These are the hormones that will be helpful. Another one, these are the one kind of the hormone. Another hormone we will say That is the thyrocalcitonin. Thyrocalcitonin. Basically, the calcitonin, if simply say the calcitonin, what they will help? They will regulate the calcium level in the blood. They will regulate what? Calcium level in blood. By reducing the calcium level. What they will do? By reducing the calcium level. So once they are what they are doing, they are decreasing the calcium. They're decreasing what the calcium. If the calcium is decreasing, then who will increase the calcium? Who will increase the calcium? There should be the gland that can increase the calcium. If somebody is decreasing my calcium, there is should be someone who can increase me. So that is the another hormone that will be there. That is our parathyroid gland. That is our parathyroid gland. So this is again the fourth of our gland. That is the parathyroid gland. The parathyroid gland, they are the four lobes would be there. Four small glands would be there. These are the four small glands. Located where? Located back of the thyroid gland. They're located back of what? They are located back of what? Thyroid gland. So what they will do? They regulate the calcium and the phosphorus. Regulate the calcium. Firstly, which hormone they will produce? They will produce the para hormone, PTH. Para hormone. That is the parathormone. Okay, or you can simply say parathyroid hormones. PTS, the parathormone or the parathyroid hormone. What they will regulate? They regulate the calcium and phosphate metabolism. So somebody was decreasing my calcium. So I should be having one my friend that can increase me. That increase my calcium basically. So that is what? That is a parathormone that will increase the calcium. But you know, this is a very selfish world. So nobody will work without any gain. So what they will do? They will take my phosphate out. So what they will do? They decrease the phosphate level. If they will increase the calcium level in my blood, they will decrease the phosphate level in my blood. And so same like with the calcitonin. The calcitonin is taking what? Decreasing the calcium in the blood. But they will try to help also. So they are the both type of the people. We would be having the selfish people also. They are the selfish, but they are also trying to help. So that's why they are making what the combination of each other so that both can be survive. So that is the also a good thing. If somebody is like helping each other, so that is a good thing. So we have the two hormones. One we have the parathormone, another we would be having the calcitonin. So both they will help into maintaining the calcium level and the phosphate level in our body. ठीक है, ये क्वेश्चन हो जाएगा. How they will regulate the calcium? They will increase what? Parathormone. They will increase the calcium level in blood. They will increase the calcium level in the blood. How they will do? By stimulating the bone resorption. By stimulating the bone resorption. What is the bone resorption? Increase the calcium absorption. What is that?
Nothing. I wanted to answer, but you are.
Tell me about the resorption. I'm asking about the resorption. What is the resorption? Is it breakdown or synthesis?
Resorption. It has to do with release of calcium from the bones.
Yeah, so this is basically the bone breakdown or the bone lysis would be there. So the bone lysis would be there, then the calcium will be out and that will increase the calcium level in the blood. Then we will see that it will be increasing the calcium absorption. They will increasing the calcium absorption in intestine. Increasing the calcium absorption in intestine and they will the resorption in the kidney. Resorption in the kidney. So that's why reabsorption in the kidney. which is a reabsorption in the kidney. So there are the three things we have discussed. They firstly they can do the bone resorptions. Means the bone lysis would be there. They will increase the calcium. Then there will be the increased calcium absorption in the intestine. Then we would be having the increased reabsorption in the kidney. So both these what they will do. Both all these things what they will do, they increase the calcium level in the blood. Okay, so this was about the parathyroid and the thyroid gland. Then we would be having, if we have discussed about the thyroid gland, okay, and the thyroid gland we would be having the two things would be there. The first we would be having the T3 and the T4 hormone. So if the T3 and T4 would be high, so there will be the hyperthyroidism would be there, where we will see the excessive production of the thyroid gland hormone. So all these things we will discuss because this is a very big topic about from the thyroid gland. But again, just write the some few pathology so that you will be able to remember. Okay, just let me write it here. Let's see. देखो, if there will be the, if we talk about the pathology here, if we talk about the pathology that is associated with the thyroid gland, if there will be the increased thyroid gland, if there will be the increase of what thyroid gland production, there will increase of the thyroid gland production or the thyroid hormones would be there. Or in the simple words, if I write increase T3 and T4 hormone would be there. So there will be the hyperthyroidism. Every one of you know this. Hyperthyroidism would be there. Then tell me that if there will be the decrease of what thyroid gland, if there will be the decrease of the thyroid gland, or there will be the decrease of what T3 and the T4. So we call this condition as the hypothyroidism. This is known as the hypothyroidism. So the, if you want to differentiate it by the some keyword, देखो, this is a very big topic. I'm not saying that this is easy. Okay, this is not hyperthyroidism. There's a lot of the disorder also associated with it, like the Graves' disease and Hashimoto thyroiditis, autoimmune, and iodine deficiency. But here we are discussing about the hyperthyroidism. देखो, if hyperthyroidism would be there, there would be the weight loss would be there. There would be the weight loss would be there. So always we have to go the cross mnemonic. Means if somebody hyperthyroidism is there, it means the weight will be on the lower side. The thyroidism will be on the higher side. Weight loss will be on the lower side. Hypo means the thyroid gland is on the lower side. So the weight will be gain. There will be the weight gain would be there. The weight gain would be there. Okay. If we talk about the hyperthyroidism, remember there will be the cold intolerance. So if you talk about the hyperthyroidism, there will be the, what we'll see in the heat intolerance would be there. There will be the heat intolerance. If everything is increasing, hyperthyroidism is there. So we will feel more heated. So that's why we will the heat intolerance would be there. There will be the heat will be intolerable. Heat intolerance will be there. Here you will see the cold intolerance. Here you will see the cold intolerance. These are the two important features that will help you to differentiate the hypo and hyperthyroidism in your questions, not in what clinical exam, not in the clinical practice. Okay, but these will help, definitely will help in your questions. What are the example of the hyperthyroidism? Like let's discuss something. So like for example, we have the Graves' disease. That is the Graves' disease. The Graves' disease is AI. What is the AI? Artificial intelligence? No, this is not. This is the autoimmune. This is the autoimmune condition, and the common causes of the hypo. Remember that is the example is here, that the Hashimoto thyroiditis. Hashimoto's thyroiditis. Hashimoto thyroiditis would be there. Okay, and also there can be the hypothyroidism, can also be there. Iodine deficiency, there can be the iodine deficiencies also, because you know in the thyroid gland production, iodine is the very important one, that iron that help in the production of the T3 and the T4 hormone. Okay, other we would be having like the In both these Hashimoto and Graves disease, both are the autoimmune condition. But the one thing is very common in the both these things. In the Graves disease also and in the Hashimoto also, there will be the enlargement of the thyroid gland will be there. There will the enlargement of the thyroid gland would be there. All these things, Hashimoto thyroiditis, sorry, Hashimoto thyroiditis, thyroid nodules, everything, goiter, everything we will discuss in the detail further on out. But here I wanted to focus on the two things: the weight loss, heat intolerance, weight gain, and the cold intolerance. So remember, if it is the case of the hyper, the weight will be on the lower side. Then hypo, the weight will be on the upper side. Okay, you can make just write in mnemonic: hyper, weight on the lower side. Hypo, weight on the upside. Okay, so remember just this for your questions. The first things, if you see the weight loss, if you see the question of the thyroid, you see the weight loss and the weight gain. Then confirm your answer that this is the case. So this can be the there is a 98% chances that this would be the hyperthyroidism if the weight loss is there, and if it is the weight gain, there's a 98% chances that this can be the hypothyroidism. There is one more pathology. Let us discuss here only. So one is the cretinism. Did you hear about that cretinism? Hmm? Did you hear about the cretinism before? The cretinism caused by the severe hypothyroidism during the infancy and childhood, they impair the physical and the mental growth, they will the mental retardation, intellectual disability, and the causes is what the iodine deficiency, thyroid agenesis, maternal hypothyroidism can be also caused, and the cretinism, this is also known as the congenital hypothyroidism. Okay. Then we would be having the next gland that is known as the thymus. That is the thymus. So what you will see in the thymus, and what is this gland? Tell me about the thymus, and then we'll take a break. If you will tell about the thymus, we'll take a break. Thymus is what? Thymus is the what kind of the gland? It is the immune organ, right? It is the immune organ as well. The immune organ. It is the endocrine glands, but also it is what? It is the immune organs, because you know which we have the B cell and the T cell. So the T cell maturation, it occurs where? In the thymus. T cells maturation occur here. Okay, let's write it here. Which hormone is produced by that thymus? Thymo. Which hormone produced by the thymus? That is the thymosin. Okay, the thymosin will be produced by the thymosin. So okay, what this thymosin will do? This stimulate what? Stimulate the T cell development and differentiation. T cell development and differentiation will be done by the thymosin. That's why we call this as the immune organs also. And this is the thymosin that is crucial for what? Crucial for adaptive immunity. That is the crucial for which things? For adaptive immunity. This is what? This is the immune organs. And where it is located? It is located in the upper chest. Where? Below the sternum. It is located in the upper chest, behind the sternum. Sorry, not below the sternum, behind the sternum. It is present behind the sternum. Okay. If we talk about the pathology, you have to remember that we would be having the two things would be there that is associated with the thymus gland. The one thing we would be having, that is the thymoma. What is the thymoma? That is the like the tumor. Okay, the thymoma and the thymus, thymoma and thymic carcinoma, in which what you're going to see, there will be the high amount of what thymus would be there that will affect what immune function and associated with the immune disorders like the myasthenia gravis basically. Then other things that can be associated with the thymus, that is the Dye-George syndrome. This is the G. This is the G. The Dye-George syndrome would be there. What you're going to see here, that is the thymic hypoplasia. There will be the thymic hypoplasia, which due to which what we are going to see, there will be the immunodeficiency will be there. That is due to underdeveloped or absent thymus can be there. Then remember that the thymus is the only organ that undergo age involution. That undergo age involution. Means like when the age will be increasing, like the person who is the elder person more will be the less immunocompetent than the adult person. So that's why, because of the thymus will start decreasing in the size with the increasing age. So the age people will be having, the more thymus will be less. Thymus will be atrophied, will be seen in that patient. Then the next gland we will be having, that is the adrenal gland. Which gland is that? Seventh one, I think. So the seventh one we would be having, that is adrenal gland. This adrenal gland, remember that this is also known as suprarenal gland. This is also known as the suprarenal gland. The suprarenal gland basically means that is the gland that is present above the kidney. Or like for example, if this is the kidney, then we would be having here the gland would be there. This is known as the suprarenal gland. This is known as the suprarenal gland. This is the gland that is present above the adrenal gland. So what is this suprarenal gland? Means supra means above. That is the kidney. Above the kidney we would be having. So it having the it will have the two parts would be there. The one we have the adrenal cortex. The one we would be having the adrenal medulla, that is the inside part, and another one we would be having, that is the adrenal cortex. The adrenal medulla, and we would be having the adrenal cortex would be there. The adrenal cortex, it is the outer layer. It is the outer layer, and the adrenal medulla, it is what? It is the inner layer. It is the inner layer. What the adrenal medulla will produce? The adrenal medulla will release the two hormones. Will form, not release, but they will form the two hormones, that is the epinephrine and the norepinephrine. And the norepinephrine. The epinephrine we can also call this the adrenaline. That is also known as the adrenaline. Another one we were the norepinephrine, that is the noradrenaline. That is the noradrenaline would be there. Okay, this epinephrine or the norepinephrine, both these are the fight and flight hormones. Means either you should have to fight or you have to flight. So they both are what? Fight or flight hormone. They are known as the fight or flight hormone. Means whatever they are activated by sympathetic nervous system. They are activated by sympathetic nervous system. Sympathetic nervous system means sympathetic nervous system basically will act on the adrenal medulla. From the adrenal medulla we would be having the release of epinephrine. We have the release of the norepinephrine, and these both hormones are responsible for the increasing the heart rate, the blood pressure, the energy, that is increasing the response to stress, or that will responsible for the fight or responsible for the flight. When, like for example, if any line is coming in front of us, or suddenly some HOD will be coming in front of us, so basically we would be having some kind of the fight or the flight hormone would be there. No, basically we don't have to fight, so we have to flight. Then we have the adrenal cortex. Now adrenal cortex, they have the three layers would be there, or the three zones would be there, like say. Three zone would be there. What are these three zones? The one we would be having, that is the zona. Then we have the zona. Then we have the zona. What are the zona? So they are the basically we have the GFR. the zona glomerulosa, zona glomerulosa, zona fasciculata, zona reticularis. When we talk about the zona glomerulosa, देखो zona glomerulosa, the G is there. The zona glomerulosa, what they will do? They will release the mineralocorticoids. They are responsible for the releasing the mineralocorticoids. I think we have discussed already this thing, right? है ना? Then fasciculata, we would be having the releasing of glucocorticoids. Then reticularis, we would be having the releasing of sex corticoids. Mineralocorticoids, they are what? They are the aldosterone. The example of the mineralocorticoids is what? That the aldosterone would be the aldosterone. The glucocorticoids example is what? Remember, the cortisol would be there. The cortisol would be there. And the sex cortisoid example, what the example of the sex cortisoid? That is the androgen, basically, the DHEA, dihydrogen endotestosterone. So this is the like the form variant of the androgens would be there. That is responsible for the secondary sexual characteristics. Then what is the function of the aldosterone? What is the function of aldosterone? You can continue from here onwards. What is the function of aldosterone? They regulate the sodium and potassium level. Regulate what? Sodium and potassium level. Means they will increase the sodium. They will increase the sodium and decrease the potassium. So that same thing, that will increase the sodium and the potassium. But if there is a one condition, if you will see the hyperaldosteronism, if you see the hyperaldosteronism, means hyperaldosterone. If there will be the aldosterone would be very, very high. So what will be the called this disorder? This is known as Cohen's syndrome. This is known as the Cohen's syndrome. In the Cohen's syndrome, what you are going to see, there will be the excessive sodium in, and there will be the hypokalemia. There will be the hypokalemia would be there. So basically, we would be having the hypernatremia, and we would be having the hypokalemia. There will be the hypokalemia. So for that, we will be giving him the treatment as the drug of the choice for this condition is what? That is the spironolactone. The spironolactone. What is that spironolactone? It is the potassium sparing diuretics. It will spare the potassium. So means whenever there is the urine, the potassium will not go into the urine. They will help to store the potassium. So that's why they will have no loss of the potassium will be done by the spironolactone. That's why we call this the potassium sparing diuretic. So that is by the hyperaldosteronism. The same, what is the function of the cortisol? The cortisol, what they will do, they regulate what? They regulate what? Metabolism. They regulate the metabolism. They regulate the immune response also. They are also known as the stress hormone. This is also known as the stress hormones. This means they are responsible for the stress things. So remember that if there will be the high amount of cortisol level, if more high amount of the cortisol level, what will be there? Cortisol will be there. So glucocorticoids, basically adrenal gland will be there. The adrenal gland will be in the higher side. The cortisol level would be high. We call this disorder as the Cushing syndrome. We call this condition as the Cushing syndrome. Then if there is a decrease in the cortisol level, we call this condition as the Addison disease. Okay, so we have the Cushing syndrome, we have the Addison disease. So they are the very, very important disorders that we would be having. Okay, the another if there will be the high amount of the adrenal epinephrine, norepinephrine. So there is one more pathology. We have the that is the pheochromocytoma would be there. Okay, and then we will discuss about the addition disease and the Cushing syndrome in the next class. So in the addition disease, basically we have the insufficient cortisols, and also there can be the aldosterone can also be low. Okay, so both these things we will discuss tomorrow. The Cushing syndrome, basically if the person is taking the steroids from the outside, so cortisol is also what? That is the steroid, hydrocortisone. And we are taking the some steroidal drug, hydrocortisone. So if somebody is taking the steroid from the outside, so what they will do, they will suppress this adrenal gland. If the adrenal gland will be suppressed, the cortisol will be suppressed. Okay, and due to which, what you're going to see, the cortisol level would be high. The cortisol level would be high because the now what you're doing, the adrenal gland is also producing cortisol. You are also taking from the outside. That's why there is a high amount of the cortisol, and that will lead to the responsible for the Cushing syndrome in this patient. Okay, so prolonged corticosteroid use, or if some adrenal tumors are there, that will also increase the cortisol level, that will cause the Cushing syndrome. And if there is involvement of the ACTH, means pituitary gland is involved, so in that condition we call this as the Cushing disease. Okay, so that you have to revise this, because this is a very important endocrinology topics, then glands and the hormones. So do revise them, and the next class we will finish about the testes, about the ovaries, the pancreatic glands, and the some heart, the some other exocrine things that also like basically the heterocline gland. Heterocline glands are those glands that act as the exocrine also and the endocrine also. So we will discuss those things also. Okay, and other pathology that is associated with it. So all these things we will discuss in the next.